I recently heard from a local resident that was hospitalized when a Lyme disease infection turned into meningitis. She wanted to pass along her gratitude to our public health nurse. She said not only was she very kind and open and encouraging to questions, she also provided me with information about my recovery that no one else had given me. It was very much appreciated and relieving. We also recently heard from a director of a local child care center. Last summer, our hearing and vision team flagged a child that was screened there for follow-up care. It turns out that child had a congenital cataract. The ophthalmologist they were referred to was so surprised, saying that they normally don't catch it so early. As you can imagine, the parents were extremely grateful that our team was able to alert them to the issue. My hope for today is that each of you finds out something new about local public health, has a new idea about how we can better work together to improve health, or makes a new community connection. If this happens, I think we've accomplished something powerful together. One way to think about public health is to think about health care, but shift from thinking about the individual patient to thinking about our entire community as a patient. If we're thinking about the community as a whole, our solutions will be different. This is especially true if we focus on where we see unjust differences in health or access to resources to support health and work together to change them. As C. Everett Koop, former US Surgeon General, said, healthcare is vital to all of us some of the time, but public health is vital to all of us all of the time. This past year, and as the COVID emergency slowed, we had the opportunity to reinforce prevention strategies like vaccination and hand washing, and emphasize the breadth of the work of your local health department with a local campaign. And hopefully you've seen or heard some of our prevention messages, whether you've been passing a billboard as you drive around Washtenaw County, or maybe even while you're pumping your gas at the gas station. Let me show you a quick clip featuring our campaign.
Learn more at washtenaw.org/health.
A little bit challenging with the sound there, but hopefully you got the gist of it. And hopefully you've seen that campaign and pieces around the community.
You may know.
And there are some other examples of the campaign and areas where we've had billboards and other items that maybe you've seen. Another way to think about public health services is to look at the 10 essential services of local public health. It provides a framework for public health to protect and promote the health of all people in all communities. How does this framework play out in our work and the everyday lives of Washtenaw County residents? Let me highlight just a few examples under the 3 broad areas of assessment, policy, development, and assurance. And you'll see more examples on the slides above me. So in terms of assessment, if you attended our State of the Health event last year or have visited our Health for All Washtenaw site, you may already be very familiar with our countywide health assessment and improvement process. Our breakout sessions today will focus on how we've been working with community partners and members to develop collaborative improvements around each of our 3 priority areas, which are mental health, healthcare access and navigation, and access to healthy food. Other ongoing assessment work includes health and safety inspections that we do on a daily basis, sampling over 150 residential drinking water wells for 1,4-dioxane just this year, and many epidemiology reports. You can see links to our recent reports at the registration table. We also work in the area of policy development. As we all know, informing and changing policy can obviously impact broader health. Think about how indoor smoking policies have changed exposure to secondhand smoke for literally all of us in Michigan. We're currently working to provide education about how access to tobacco and vape flavorings will impact illness rates among people, particularly people of color, and how or if the next generation of young people becomes addicted to nicotine products. As a maternal infant health provider, we participated in an evaluation with the Michigan Department of Health and Human Services and the University of Michigan Youth Policy Lab to determine whether expanding services was effective in better meeting the needs of families. From the pilot, we learned that there was a positive impact on families' self-reported social determinants of health, notable benefits for Black families, and was particularly beneficial for families experiencing their first pregnancy. As a result, starting October 1st of this year, Medicaid will reimburse providers for enhanced services, including additional home visits, care coordination, and discharge, all of which will bring long-term benefits to participants. And in the area of assurance, this is the idea that someone has to provide essential services, and as your local health department, that may mean we have to provide those critical functions that wouldn't otherwise be provided. This sometimes is how we describe our environmental health work. We are who you call when you don't know who else to call. Another easy way to think about this is disease control. We will do that follow-up and make sure treatment is completed for serious infectious diseases like tuberculosis. We won't turn away community members who can't pay for vaccinations or treatments for sexually transmitted infections. During COVID, we had some excellent examples of how we play a role in insurance. As our hospitals were overwhelmed, our medical director, Dr. Juan Marquez, provided standing orders to help support community-based testing sites. In addition, we worked with very many community partners, many of which are in this room, to ensure that services and information were provided where the impact was highest during COVID. The most important thing about this framework is that you'll notice, if you can see it, in the middle is equity. Equity is at the center of the framework. It's at the center of our work. It is a guiding force in the work we do in local public health and as your local health department. And so much of that assurance, policy development, assessment, we can't do without partnerships, like having all of you at this event and working with us day in and day out to address public health needs of our residents.